actually right behind me here, and that's staffed by departments of health, human services, drug and alcohol programs, aging, state corrections, the state police, PEMA, that's Pennsylvania Emergency Management Agency, and the Pennsylvania Commission on Crime and Delinquency. That's 9 agencies. I think we now are up to 12 agencies. There's 3 additional agencies that have been joined us in the Unified Coordination Group. They meet weekly, this group, to analyze our progress, and they also make recommendations for new initiatives. Second, Dr. Levine, our Physician General, who will speak in a moment, signed a naloxone leave behind standing order, allowing EMS officials to leave naloxone behind with a person or a family member after a substance use disorder sufferer is revived, or if a first responder believes there's a need for medication. There are several agencies around the state, including the City of Pittsburgh EMS, Fayette County EMS, Bucks County Emergency Health Services Department. They are already participating in the Leave Behind program, and there are others. Next, and this is third, we expanded access to the prescription drug monitoring program to other Commonwealth departments for clinical decision-making purposes. And numerous local and state departments have already gained access to the database, and we've connected with every surrounding state, their own PDMPs. Fourth, we undertook to waive fees for birth certificates for individuals with opioid use disorders. And that allows them to get faster access to treatment. So far, over 80 birth certificates have been expedited through this process to help people get into treatment more quickly. Again, time and speed is of the essence. We waived the face-to-face requirement for physicians to intake patients into narcotic treatment programs. Sixth thing is we've added non-fatal overdoses and neonatal abstinence syndrome, NAS, as reportable conditions. And since we have seen since then, we've seen a 64% of hospitals and birthing centers reporting information about babies born with NAS. This allows us to keep track of them, to help them as parents and the child as they go through these critical points in their lives. Seventh, we've waived annual licensing requirements for high-performing drug and alcohol facilities, and we've already seen 50% of eligible facilities apply for 2 rather than 1-year licenses. Eighth, we've unveiled the opioid data dashboard to help the public gain access to information about what resources are available locally and where those resources need to be deployed. Ninth, we have rescheduled fentanyl derivatives to align with the federal DEA schedule. It's now Schedule 1. And it's important to note that this synthetic fentanyl, this is the synthetic fentanyl that we're talking about. It's an increasingly dangerous and lethal drug, and it's not to be confused with fentanyl that is prescribed legally by physicians. 10th, we've worked through the Pennsylvania Commission on Crime and Delinquency to get naloxone into the hands of more law enforcement personnel and first responders across the state. 11, we've begun promoting the Get Help Now hotline with a statewide service campaign so that anybody suffering from substance use disorder or anybody in their family can have somewhere to turn, someone to talk to, and someone to get connected with in case they need resources to begin the recovery process. And then finally, we've also taken the opportunity throughout this declaration to work with those in the healthcare field to expand access and streamline the process for getting into treatment. Last month, I announced a new Medicaid policy that waives prior authorization requirements for medication-assisted treatment. And again, just that 24 hours allows treatment providers to get MAT to individuals faster. And again, time is of the essence. So throughout this initial declaration, we took concrete steps to address the needs of local communities, the healthcare industry, and first responders so that they have the full support and the tools of government behind them.